Hi guys, it's Grace. I'm back with 5Features, and today we're sitting down with Dr. Harvey with Harvey Pediatrics to talk about their brand new newborn clinic. This newborn clinic is unlike anything you've seen in the area and protects your babies from all the germs that you find in normal pediatrician offices. And don't forget to like, share, and comment on this video for a chance to win a $100 health and wellness gift card to MedQuick in Bentonville. Thanks for watching.
Hi, I'm Dr. Brian Harvey. I'm a pediatrician in Northwest Arkansas. I have a pediatric practice that has been in Rogers for a little over 10 years. We take care of children of all ages, and the groups that we try to protect the most is our newborns, and we have found that one of the biggest concerns that parents will have when they're either fixing to have a baby or have actually had a baby and are in the nursery and kind of deciding and picking a clinic that for that first few visits where you're worried the most about having the baby exposed to infection, that taking the baby in for that first visit can be very nerve-wracking when you know that there might be a lot of other children who are there also at the doctor who might be sick. To help prevent that, we have built, as part of our practice, a completely separate office. It's in the same building, but it is only for newborns and infants who are well for the first few visits. With that, it allows us to have a sterile, clean environment. It allows you to have more protection for your baby where there haven't been any other children in that office who have been sick. So the rooms are clean. It's a warm environment. We work to keep it sterile so that your newborn and young infant can be as protected as possible. For some of the even higher risk, if you have a baby that was premature or has some type of complex medical condition, that need for and desire for having your baby protected when they're going to the doctor is probably even stronger. And so we felt like that was important enough that we designed this office to have its own freestanding newborn clinic. And that office is just going to have newborns, babies in the first few weeks and for their first couple of checkups who are well. In that office, there's no older sick children. It allows us to keep it sterile and warm and clean so that at least for the visit to the physician, you don't have to worry about the baby being exposed to infections. And as we're getting into the winter and you start having influenza and RSV and all of the other kind of colds and bugs that flow through the community, then you can be confident that your baby is going to be able to come to our clinic and have a separate environment that isn't going to have them get exposed to quite so many things as maybe in a practice where all the children, even the newborns, are kind of all in one waiting room. I trained at Arkansas Children's Hospital and have been in practice in Arkansas for a little over 25 years. And a big part of pediatrics is your work with young children, especially with families that have babies. Those are oftentimes the children who are at the doctor the most. For the last 10 years, we've worked to have a completely freestanding part of the practice that is just for newborns and parents with young children, to allow them to really have their baby in a sterile, clean, separate environment, a separate waiting room, separate exam rooms. The physician during that time that they're in clinic would just be going from room to room just with healthy children so they can take the time to be able to visit with parents and answer all their questions. And not only do the families have the ability to know that they're in as clean and sterile an environment as possible, but that also the provider isn't going from one room where there's someone ill and then into the next room where they might be seeing a baby who was just discharged home 3 days ago. That was part of what pushed or drove us to want to create this. Was you would see a family in the hospital and then need them to come into the clinic for jaundice, a day of life 2, 3, or 4, and everything would be fine. And then 4 days later, after them being in the clinic, they would be coming in with RSV or flu or vomiting, and it would be difficult not to say maybe they got an exposure while they were at the doctor's office. And so as a result of that, we wanted to develop the clinic as we have it now, where it's the newborn and infant clinic is freestanding. And it has been very successful. We have seen over the last 10 years as we've had this, that we have not had the incidence of children coming in sick at day of life 10, 12, 14 after being in the clinic. That I think really does tell us that this works.
Thanks for watching. As you can clearly see, Dr. Harvey and his team have state-of-the-art equipment to take care of all of those babies. And don't forget to like, share, and comment on this post for a chance to win that $100 health and wellness gift card from MedQuick. And make sure to tune in next month when Dr. Harvey and his team are back.